Hello and welcome to Module 5, Pediatric Sleep and Occupational Therapy Clinical Applications. In this final module, we will focus on how pediatric occupational therapists can apply clinical reasoning when sleep concerns may appear in practice. This module is intended for educational purposes. Occupational therapists support sleep through routines, environments, and participation. When diagnostic concerns are present, we collaborate with other healthcare providers. Clinical decisions should always be made in partnership with the family and the interdisciplinary team. In this module, we will focus on two main objectives. First, applying occupational therapy clinical reasoning to common pediatric sleep presentations. Second, we will use the clinical pathway to help guide intervention decisions and determine when referral to another healthcare provider may be appropriate. We are going to do a brief recap of where we started. We began by reviewing the foundations of pediatric sleep and how sleep develops across childhood. Next, we discussed how occupational therapists can recognize sleep-related breathing concerns and when a referral may be appropriate. We then also explored OT strategies that help support sleep through routines, environmental supports, and caregiver education. And in this final module, we bring those concepts together and focus on how this looks in clinical practice. Before we move on to the case presentations, this slide highlights the clinical reasoning process we discussed in the previous modules. Sleep concerns in children often first appear as participation challenges and or even changes in their daily routines. And from there, we look more closely at their sleep patterns. As occupational therapists, we then connect those patterns with routines, environments, and occupational performance to help guide the intervention and or if a referral needs to be made. Now that we have reviewed the clinical reasoning process, let's look at a simple pathway that can help guide us in our approach to pediatric sleep concerns. The first thing we need to do is identify whether there is a sleep concern, which could be indicated by participation challenges or changes in the child's daily routines. Next, we screen for contributing factors such as sleep behaviors, routines, the child's sleep environment, and caregiver reports. And from there, we decide the next step, which could include routine strategies, environmental supports, caregiver education, or referral when appropriate. Let's look at a few common ways sleep concerns may appear in pediatric practice. We are going to review Layla, who is 5, Sam, age 6, and Mia, age 4. On the next page, we will talk about the intervention strategies. For these cases, we look at how occupational therapists can apply the clinical pathway in practice. We first identify the concern, then we screen for possible contributing factors, and finally, we plan the intervention and refer if appropriate. We're going to first start with Layla. Layla uses technology before bedtime. She has inconsistent routines and has difficulty falling asleep. The OT intervention would look like 1, establishing a consistent bedtime routine, 2, reducing technology use before bedtime, and 3, introducing calming activities before sleep. Next, let's take a look at Sam. The parents reported mouth breathing during sleep, restless sleep, daytime fatigue, and a history of enlarged tonsils. In this case, the OT's role here is recognizing those red flags, and then make a referral to either a sleep physician, an ENT, or even a dentist. And at the same time, the occupational therapist can still support healthy sleep routines with the child and the family. We then have Mia. Mia wakes up frequently during the night and has trouble falling back asleep without her parents. The pattern often points to a sleep association. And in this case, the occupational therapist can help by providing caregiver education and gradually supporting the child in learning to fall asleep more independently. All of these examples show how the pathway helps us decide when occupational therapy interventions may be appropriate and when a referral may be needed. And more importantly, they highlight how occupational therapists can play a meaningful role in identifying and addressing sleep concerns in pediatric practice. As we wrap up this module, these are the key takeaways. First, sleep concerns do not always show up as a sleep complaint. Often we see them through participation challenges, behavior, or difficulties with daily routines. Second, occupational therapists are in a great position to recognize sleep patterns and contributing factors during evaluations, especially when they look closely at routines, environments, and family habits. Third, occupational therapy interventions can support sleep through consistent routines, environmental supports, and caregiver education. Some sleep concerns may require referral to other healthcare providers, and recognizing those situations is an important part of our role. Overall, by increasing our awareness of sleep in pediatric practice, we can help support better sleep and better daily participation for the children and families we serve. Before we wrap up, I want to say thank you to Comprehensive Sleep Medicine Associates, Dr. Gerald Simmons, and my site supervisor, Alicia, for supporting this project and for the work they continue to do in neurology and sleep medicine. Dr. Simmons is triple board certified, and his practice serves patients in the Houston and Austin area with 4 locations across Texas. They treat patients of all ages and also offer virtual visits for patients anywhere in the United States. For occupational therapists who are working with children with more complex sleep concerns, collaborating with a sleep specialist such as Dr. Simmons can sometimes be an important next step. If you'd like to learn more about their services or referral options, please scan the QR code on this slide. I'd also like to thank Dr. Buono and Dr. Hoffman for their mentorship during my capstone project. I truly felt supported, and with their guidance, feedback, and encouragement, they both played a big role in helping me develop and complete my online learning modules. I truly appreciate the time they invested in mentoring me through this capstone journey. And I would also like to thank my doctoral capstone coordinator, Dr. Greer, for the guidance and support throughout this process. Your feedback and encouragement helped shape the project and made this experience incredibly meaningful. Before we finish, these are the references used in this module. The next slide will include the QR code for the post-module survey, and I'd really appreciate your feedback. Thank you for taking the time to watch all 5 modules in this series. If you have a moment, please scan the QR code to complete the post-module survey. If you're having trouble scanning the code, the survey link is also included in the video description. Your feedback will help shape future education and resources for occupational therapy practitioners. Thank you again for your time and engagement.